Question, why is prostate volume so important? Does HIFU treat the whole prostate or not just the cancer?
Correct. The technology exists to just treat a focal point or half of the prostate. It's not commonly done that, and that's not the way we do it. It's not really mainstream to do that yet. There are some people that are treating sections of the prostate, whether that's with radiation or cryotherapy or even HIFU, but I don't do that, and it's really not common to do that, and really I don't think is accepted quite yet to do that. The technology exists to do that in the future if that can be. The problem is when you do a prostate biopsy, it's literally a random sampling of the prostate. You're taking 6 random samples on the left side, 6 on the right. It can be positive on some of them. That doesn't mean you hit the prostate cancer. You could have a big prostate cancer focus here, but when you do the biopsy, you just may miss it. So to assume that the only cancer you have is just what shows up on the prostate biopsy is a little misleading. You have to assume there's more there. So really it is treating the entire prostate. As far as the limitation of the size, that really is just a factor of the limit of the probe right now and the limit of the technology. That the probes don't exist to reach as far enough anteriorly towards your abdomen. It can only reach so far at this point.
Why the Gleason cutoff of 7?
Why? Because the research just isn't there yet to really prove it can handle high-risk disease. And for that matter, some people would argue neither is surgery at this point either. If you have high-risk disease, you won't find many HIFU doctors that would feel comfortable treating high-risk disease at this point. You sort of, when there's a new technology, you want to prove that it works. If you're treating everybody with high-risk disease that may or may not fail regardless of treatment, you don't really know how good your treatment is. Does that make sense?
Mm-hmm.
If you sort of start out and say, okay, this disease is either small or moderate disease, we have a good shot at curing this, let's sort of focus on these patients first. Once we have good 10, 20-year data and prove it's a real good treatment, then maybe we can tackle the high-risk guys. Otherwise, if you go straight to the high-risk guys and you fail, you don't know if you failed just because it's real high-risk disease and you would have failed anyway no matter what you did, or whether the treatment just doesn't work.
Is there a reason why this system, or this treatment system, was developed in this country and has taken hold in other parts of the world? Yeah. Well, I understand that.
Yeah, and that's actually, we'll go into that. It's not FDA approved yet. There are phase 3 trials going on now. Hopefully it will be approved within the next 1 or 2 years. It is a lot easier to get things done in other countries, obviously. Most technology, in fact, is done elsewhere and then sort of seeps in through this country. Whether it's developed here or not, it can take a while. In fact, surgery and radiation are actually, have never been FDA approved. They got grandfathered in. The only reason that this needs to go through trials is because even though the technology was there, it was not used for this purpose. So you're sort of forced to prove that it works. Otherwise, if it had been around earlier, it would have been grandfathered in and it wouldn't have been an issue.
When it already has the research on the prostate, and he doesn't have the prostate there, this technique still available and live.
It has the potential to if you have some tissue there, meaning sometimes, not often, but occasionally someone will have surgery and some of the tissue will remain. The surgeon wasn't able to get it all for one reason or another. So you may have a portion of the prostate that's still there. And when I was training for this, they actually shared me the story of how that happened, and they treated someone for that. That's very unusual. Sort of an outlier, so, but it is possible. Yeah. Typically, if someone has had surgery, the prostate's removed, and if there is a recurrence, it's because there is either cancer that's spread into the bed of the prostate where the prostate was, or it's spread elsewhere. Usually that's, the treatment for that would be radiation treatment or hormonal treatment, so it's much less common to use HIFU after surgery. The simple fact that usually the prostate's not there. Okay. So we talked about who qualifies for HIFU. And we talked a little bit about this just now, but other patients that can qualify for HIFU are patients that have failed radiation therapy already. So patients that have had external beam radiation therapy, or even seeds placed, can potentially have the HIFU treatment. Now, with seeds, there may be sort of that, it may appear that there's calcifications there, as the seeds can cause sort of an echo when you do the ultrasound, not to get too technical, but sometimes the ultrasound waves may not be able to penetrate through the seeds, in which case you may not be able to use it after seed placement. But after external beam radiation therapy, HIFU can be used. Cryotherapy, patients that have had cryotherapy and failed can have HIFU performed. Again, we talked a little bit about prostatectomy patients, again, unusual for that to happen. And then patients, again, who have failed HIFU can have it repeated again. The procedure itself, and Mr. Messick can talk to you again about the specifics from his point of view, but the procedure itself takes about 1 to 4 hours, depending on the size of the prostate. Again, that's a limiting factor. If your prostate's 80 cc prostate, the technology isn't quite there yet to do that, and it's going to be an 8-hour procedure. You don't want to be in that position under general anesthesia for that long. And so part of that is just the length of the procedure. You don't want it too long. It is performed under general anesthesia typically, although I have heard reports of it being performed under spinal, but I wouldn't do that. Therapy is delivered by a probe placed in the rectum, and that's where the ultrasound beams come from. And you recover in the recovery room for about an hour or so, and then go back to your room. This is the machine itself. This is the probe. That's what's placed in the rectum, and this is the cooler system. This is the computer machine that we use to do the mapping and perform the procedure. To the right is a sort of animation drawing of the procedure. This is the probe that's placed in the rectum. This blue is the prostate, and these are the ultrasound beams that meet at that focal point or focal zone. Again, here's another drawing showing the beams focusing at that focal point. And then I'm going to show you a quick little animation here. It's a minute or two long, so if you have questions, just shout out because it can get a little boring. But basically, what we do first is we place the probe, we map out the prostate, make some measurements of the prostate, and then what you'll see in a minute, what we do is we basically cut the prostate into at least 2 zones, if not 3 zones, depending on the size of the prostate. And we treat each zone prior to moving to the next zone. And that's the top zone, the middle zone, and then if it's large enough, the 3rd zone down below. And when we measure the prostate, we map out each zone, we tell the computer where we want to go, and then the computer will perform the ablation of the prostate. After each pass, we can stop it at any time if we're not happy with it, remeasure, and then reset our parameters. But once we finish with each column, it moves to the next column. And once we finish each section, we look back, make sure we've treated everything. If we're not happy, we can go back, retreat the whole thing if we want, retreat the sections we were not happy with, and really manipulate it any way we want. And we start out with each column, march down the column, and when we're finished, we go to the next column. And again, each sort of pulse is about 2 to 3 seconds, and that's when the heat is generated, up to close to 90 degrees Celsius.
I know this is an animation, but how big is this probe?
The probe itself?
2 pencils, 3 pencils size?
No, it's larger than that. If I were to show it to you, you'd say, "Oh my God, that's going in my rectum."
That's what I was curious about.
You would not want to do this weight, put it that way. It's smaller than this water bottle.
Oh my God.
Maybe half to 2/3 of the water bottle. When you're asleep, you relax and you can distend the rectum more than you think. That being said, you wouldn't want to be awake for the procedure. So once we're finished, again, we can go back, make sure we're happy with what we treated. If we need to retreat anything, we can do that.